Good morning, everyone. It is so wonderful to be here with you. My name is Sandy Markwood, and I am the CEO of US Aging. I am thrilled to be opening up this special session today on the 2022 Community Assessment Survey for older adults, the results of that survey, and on the demographic presentation. We've talked so long, and you live every day on the impact of demographics in your own community. As we start out this session, and again, I want to thank the Colorado Association of Area Agencies on Aging for hosting this session today. The demographics will really drive a lot of changes in your community. And these are changes that you live with every day as you provide services and supports to older adults, more and more people with disabilities, and also their important caregivers. So, as we start out today, I just wanted to give you a little bit of a framer about the importance of aging issues that are emerging on the national front. So, as you hear about these demographics, that you will be able to put them in a context of the aging issues that are being faced nationally, and I'm sure also relate locally here in Colorado as well. So I'm going to share my screen, I hope. Here we go. Ah, okay. Here we go. Let me see if I can try it again. Okay. You know, it's one of those things that sometimes you practice all of these things and it doesn't work. Let me see here. Nope, that's not working, and this is not working, and I'm sharing my screen. So, if that is the case, then I'll just tell you. I'll just talk to you about what I was gonna share, and I will be happy to provide you, all of the slides for this presentation. But I wanted to highlight to you what I see as the new directions and innovations for the Aging Network. And when we're talking about the major issues facing our country today from an aging perspective, you all know, what we're looking at is a post-pandemic recovery. What's the new normal? And defining what that is for the aging network. We're also still tackling the issues of social isolation and looking at, on top of that, dealing with issues around the workforce related to direct care workers, but also your workforce in the aging network. And also looking at the lack of investment that we have in home and community based services. And we got a lot of funding through the COVID relief funding measures for home and community based services through the Older Americans Act. But in so many communities, in so many states, we're about to hit a cliff on that. Or as Amy Gottwalls, our director of public policy, said, we're hitting a mudslide because people are hitting that cliff and running out of funding at different times. And then also looking at long term care services and systems that rely on impoverishing people, to go to Medicaid. To be able to get long term services and supports, and at the same time, overburdening family caregivers. And then also looking at healthcare costs and the fact that as we have more emphasis on the social determinants of health, the healthcare costs only really are reimbursable for health, direct acute care healthcare, and not the social determinants of health, which is a sweet spot for the aging network. And then also looking at the fact that when we're talking about our mission of ensuring that people can age successfully in place in their home and their community, they need transportation. They need affordable, accessible housing. And housing is becoming a major issue impacting older adults, both in terms of affordability, accessibility, but also the rising rates of homelessness among older adults. And then there is the issue of dementia, which is ever growing, and recognizing that 80% of people who are living with dementia are living at home and in the community. So our world, as a result of the COVID crisis, changed. And in saying that, you all responded heroically and you changed your services overnight. But you also innovated, and you innovated because you had to, because the normal ways that you delivered services were no longer available to you. But the other thing that happened in this, and I'm sure that this will come out in today's presentation, is that you all are serving more older adults than you've ever served before. When we did a poll at US Aging in the spring, what we found out that 94% of the respondents, the area agencies that responded, said that they were serving more clients than they ever had before. And 95% said that of those clients that they were serving, that they had more complex needs than ever before. So you are serving a broader group of older adults, and you're also serving people under the age of 60, and you are serving their important caregivers. So when we look at the demographics, and the drivers there, what we also know is that it's driving major changes in the aging network. So as you go into your demographic discussion, I just wanted to highlight some ways that I believe that we are now moving into what I call aging services 2.0, looking at what will aging services be for the current generation of older adults, but also as we look to the future generations of older adults. And that includes looking at new ways of delivering services, looking at hybrid models of services and flexibility and emphasis on technology, recognizing how we blend that technology, which we need to have, but not all of your communities have broadband, and not all of your communities, area agencies have access to all the technology you need. In addition to that, we also have the issue that the sweet spot of the aging network, as we're now moving back into the home with assessments and services, has been being in the home and seeing clients in the home and what their needs are. So, how do we blend that, the hybrid, along with the in home supportive services, to be able to ensure that we can reach these growing numbers of older adults with complex needs? And also looking at social isolation and engagement, which was an issue, as we know, before the COVID crisis, and it certainly will remain an issue if we ever get to the other side of the COVID crisis. And recognizing that the role that the aging network has played in meeting the needs of socially isolated and lonely older adults has been critical, and is really now seen as a core service of what the aging network does, as well as delivery of home and community-based services, and looking at it in terms of a caring economy, recognizing that what you do kept older adults living safely at home and in the community, recognizing that during the COVID crisis, many people moved out of institutions back into the home, but to meet the needs of their important caregivers who needed to remain active in the economy, and recognizing that you're really serving both client bases. You're serving the older adults, but because of those services, either directly or indirectly, you are serving the caregiver, and as a result, you're serving the community at large. And then also recognizing the partnership and engagement with the disability community, and recognizing, which is something to be celebrated, that people with disabilities are living longer. But because they're living longer, they're also going to be transitioning into the aging network. And the question is either network, the disability network or the aging network, ready for an infusion of older adults with disabilities, a range of disabilities that are aging into our systems? And then communities. Community really came to the forefront. It has always been there. It's always been a foundational point for the aging network. But as we look at the communities responding to the needs of the demographics that Nancy will highlight, it's looking at creating age-friendly communities, but also, because of the rising numbers of people with dementia, creating dementia-friendly communities, so that 80% of the community who 80% of older adults living with dementia can remain and thrive in the community for as long as possible. Some of the other aspects of Aging Services 2.0, what I think it looks like, is supporting caregivers and recognizing the important role for caregivers at the community level. And you know this, but when we're looking at the demographics, it's not just the demographics of people over any specific age, it's also looking at the demographics of the caregivers that support them at the community. And it's also looking at the workforce and the volunteers who provide those critical services. Your workforce, which we know, and I'll highlight just in a minute, is stretched, as well as the direct care workforce, and then recognizing that so many area agencies on aging and Title VI agencies also lost volunteers because of the COVID crisis. Over 50% of area agencies on aging, when we did that poll in the spring, said that they had lost nearly half of their volunteer workforce. So, you know, when we look at providing services to this growing number of older adults, it's and caregivers, it's being able to have the capacity or the infrastructure to do that. And then also looking at partnering with healthcare and partnering with public health, which are also new opportunities for us, as well as, again, putting the stake in the ground for the social determinants of health that you do. And doing all of this under the umbrella of being able to work with and to be able to address racial and health disparities. So, really quickly, looking at the strengths of the system, I just also wanted to highlight as we look as an aging network at meeting the needs of the demographics of the aging population and the caregiving population, it's being able to address the workforce challenge for area agencies on aging, but also for your providers so that we can meet these critical needs. And then also wanted to highlight to you on the caregiver front that the national strategy to support family caregivers was released at the end of September. And it is really focused in on a whole society roadmap of services and support for caregivers. And there's a 60-day comment period out there. If you haven't seen it, take a look at that national strategy, which includes actions, 300 actions that fall into buckets around respite, professional support with day-to-day responsibility and complex medical tasks, caregivers as part of healthcare, financial education for caregivers, better identification of family caregivers, and also research. So as I wrap up and you go into your the rest of your session, I just wanted to highlight the importance of the framework that the Aging Network is working in, and would love to hear more from you after this presentation about additional ways that US Aging, your national organization, can help support you, all of the area agencies in Colorado, around these important issues. You know, demographics are a driver of change at the community level, and you all are the conductors on driving that change in your own communities as it relates to older adults, but recognizing that you need support in doing that. And part of that support is getting additional funding support. So I wanted to leave by also asking with a request. In addition to the information that's being presented about the demographics in Colorado, currently out in the field to all of the area agencies on aging, we have our 2022 National AAA survey that really helps us to determine the trends and new directions of the aging network. And it also provides an opportunity for ACL to go to other federal agencies to talk about the need to partner with area agencies on aging. And then we also do a companion Title VI survey. But it's what we take up to Capitol Hill as we advocate for more resources, more investment in services and supports for the older adults in your communities and in every community in the country. So I'd ask you a little bit of a plea to please fill out that survey, because I think it's the combination of the data that's going to be presented to you today, the data that we collect about what's happening in the network, and then those important stories that you have locally about the needs of older adults. So with that, it's again an honor and a pleasure to be with you. And I apologize, I couldn't, the slides wouldn't pull up, but I will absolutely get them to Aaron. And I also wanted to recognize Eva Veach, who is on the U.S. Aging Board and represents Colorado so well. So I am now going to turn the program over to Michelle Kobayashi, who's going to talk to you more about the importance of the demographics and the aging population in Colorado. Michelle.
Do I need to do anything to turn? Oh, yeah, I'm on. Hello, thank you. I'm so happy to be here today. And I think I've met most of you in Buena Vista. Who was at Buena Vista? Oh, some of you I did not meet. And I don't know, how many people were here in 2018, 2019 when we did this? Okay, so a few of you know me. But just a little background, I work for National Research Center at Polko, and I'm here with Jada Roca and Kim Dane, who are my co-workers. But we have been working on CASOA for many, many years. I personally helped the origin of CASOA, and you may have heard this before, is from Colorado. 20 years ago, I remember, because I was pregnant with my daughter who's about to turn 22, so 21 years ago, started working with people at the city of Boulder, where they came to me and said, you know, we want to do our 4-year plan, and we want to really assess some of the needs that people have in our community. We also want to understand the assets. And so we want to have a strength-based model, but we also want to be able to have real data to put into our plan. So started working with the folks at Boulder, then moved on to Dr. Cog, started working with Sue Bosnowski, that group, then started working with Jayla. So anyways, by 2010, we finally got a critical mass and got the state to help fund the first CASOA here. Then again, through the next years, people were trying to get money, but basically we're able to iterate it a couple other times based on, basically foundations did it the last time. And now you guys were able to raise the money again to do it statewide. So it wasn't just for the AAAs like Dr. Cog and Boulder that may have been a little bit more highly resourced. So always have loved the fact that it came out of Colorado. Just so you know, the survey itself too had much feedback from all the folks in Colorado when we were developing it. I was doing lots of literature searches and work on older adult needs, trends, and we keep doing that every few years to make sure we're updating CASOA. And if you look at your old CASOA versus the new one, you'll see there are new types of questions on it, because we just want to make sure we keep it constantly evergreen. But Colorado had a strong influence in the questions that were chosen and what we did. So anyways, always love to come back to the folks who kind of is the origin story of CASOA. And also, you know, you doing it now, we have the data points and a trend line, love it. We have a number of new states doing CASOA. So Montana's doing it for the first time, New York's doing it for the first time, Virginia's doing it for the first time, California's doing it for the first time. So they'll probably be looking to you all too, just to see how you use your data, what you're doing, if you guys don't mind, or if you put some of the stuff out. But I think there's a lot you could teach some other states about how to work with CASOA data once that comes out and how you use it in your plans, because I feel like you are the most progressive group in terms of really actually using the data and making sure that it's, you know, really reflecting the needs of the Colorado population. So let's move on and talk about our data for this year. Again, I was part of National Research Center out of Boulder, Colorado. We were a company for 25 years doing research and evaluation for local governments, AAA, state government for many years. A few years ago, we merged with Polko, which is a civic engagement platform. So we got the technology to be able to actually, our ability to scale the CASOA this year to so many different folks is in fact due to the fact that we could actually save a lot of money and time by automating all this types of work. So we now have this platform, and so that helps us in terms of budgets for you, but it also helps you because you now have subscriptions to this platform. We'll talk at the very end about how if you want to engage your older residents who get online on this platform, you don't have to stop with CASOA. If you have new ideas, new questions, you want to dig deeper into some of the needs that you experience in your community, you have that ability to go online and do that with the folks if you want them to, you know, have that kind of conversation. And we do encourage people to kind of build panels of folks that you can talk to regularly. So I'll talk to you more about that later this afternoon, but just want to let you know one of the other advantages of us being technologically, you know, up to date is that you actually now have an inexpensive way to communicate with your older residents, at least those that will get online. Next slide, please. So what we're going to do today, and we kind of are in two parts, but the first section, I'm going to go over the survey highlights. We're going to debrief the survey results at the end of this first session. And then we're going to have the demographer talk, give us all the demographic trends, take into account a lot of different data, go to lunch. Then we're all going to come back together and do kind of what we did the last time, which is identify some key focus areas for the state where we think like maybe we should move forward or have the most advocacy or some consistency around. And then also brainstorm some strategies, ideas we think we can use to move forward to kind of promote to promote the most important pressing needs at the state level. The other thing we do with this kind of workshop is you can do this yourself at home. And I would recommend it if you can. If you have the resources or time for your plan, you can use the same format, present your data for your AAA if you want, and have stakeholders in your community have conversations. I've been part of really important conversations, especially if you involve not just your staff, but invite some older residents, maybe ask people from the business community, ask some folks. I think, Aaron, you had something where we did at the Alpine area where you actually invited some of the mayors, didn't you, from like different towns? I feel like you guys, yeah, and they actually, having the mayors from some of the cities sit through the presentation and realize, oh my gosh, like these older adult issues actually do affect my community and I have a role in playing it. So like I would encourage you after you see this format, or we can even talk about different kinds of formats, you going back home to your own AAA and holding your own like mini next steps workshop and involving members of the community, because we all know we can't all do it alone, right? So all of a sudden having maybe some business owners in the community, say you have employment issues as a topic area you really want to work on, having employers sitting there, or caregiving. I remember I had done it in Kalamazoo, and having some of the employers there hearing that older adults needed jobs. Well, all of a sudden the employers, it's like a light bulb switched with one of the employers saying, we don't do anything to support older adults. Maybe we should do that and try to get older employees. And given the workforce alignment issues in Colorado, this might be a really good time to start talking to employers across the nation. So anyways, I'll talk about it again, but just want to let you know when you're thinking about what we're doing here, if you can think about how you can maybe do it back home for your own plans or your own good, I think it's a great model in terms of getting everybody gathered around the same data and the same goals. Next slide, please. So I want to start by asking you all a question, and again, we have to remember the virtual audience, so pass the microphone. We're going to look at the data, but without looking at the data, what do you think is working best in your communities in terms of supporting older adults? What things are working best for you that you think you're doing well? And you just flag your hand if you want to hold the microphone, and I know it makes it more intimidating to have the microphone, but
I think one of the things that we did best when COVID first hit is that we, sorry to use this word, pivoted really quickly to be able to serve the needs of the people where they were. So all of our congregate meal sites shut down. We switched really quickly to home delivered meals, grab and goes. And thankfully the funding allowed us to be really innovative in how we continue to serve individuals in the community, and it didn't take us 6 months to figure that out. It maybe took us 2 days. So I think that was, and then we were able to take those best practices, and some of them we're still providing services in that way because it's still meeting the needs.
Great. Other things you guys did well?
I remember as we were starting all of the stay-at-home regulations during COVID, the amount of communication through the network just skyrocketed, whether that was providers directly with AAAs and in Region 4. I still joke about executive directors calling me at 5:15 saying, hey, we just came out of a leadership meeting and we want to run something by you. And I continue to encourage that. But we saw that amongst the providers, we saw that amongst between the providers and us at our AAA. But we also saw that increase the strength of our own Colorado network among AAAs. A lot of idea shares, and we continue to hold those meetings, not quite as often, but that has been a huge boon as we've seen AAA directors retire and new AAA directors coming in. We have just a really excellent network that we can bounce ideas off of. The communication, I feel, with our state unit on aging has increased, so we can have more robust conversations around the needs of our state. And so that is certainly something that worked out well. While not directly impacting our older adults, it was key to be sure that we could continue to impact our older adults.
One of the things we found, I've been an evaluator for a long time, but some of the big federally funded programs, they would give a lot of money to a community to stop drug use or stop teen pregnancy. And what they would find after the grant was done is they didn't change drug use or teen pregnancy, but what they did really change is the collaboration and the ability, almost like the readiness of the network to act. And that's not all you're saying, but it kind of reminds me of that, where sometimes it takes a crisis or something like that to actually get you to be ready, to understand those relationships, get people to collaborate. So the next issue, you're actually better set to move forward. Yeah. Other comments about what went well? Yeah.
I would say our staff really came together. Social isolation, of course, was around long before the pandemic, but I really think with the pandemic, it extricated it. Sorry, I can't talk this morning. And really, with the support from the COVID funding, we were able to really think outside the box. When ombudsmen couldn't go into skilled nursing facilities, how are we going to talk to our clients or the residents? So, let's take this money and buy tablets. So we still had that communication. And there were some other really unique projects that were done all across the state. But I really want to focus go with what Jody said as well. I think just the collaboration and the networking, the increased communication with the state, but then really with the AAAs across Colorado has been very impressive.
Great. I know disruption is hard, but also there always are some silver linings, usually, right? Anything else anyone wants to say? Okay. What about the challenges? What were the biggest challenges for you all for the pandemic? I mean, I know there are lots. So, but can you think about the biggest challenge?
I don't know if this is exactly what you meant as far as looking in the past, but I think that it really started in the past, and I am really concerned about it going into the future, is the workforce to support being able to age in place. I have huge concerns about that. And then as we were wrapping up our community conversations 4 years ago, when we were talking to you, Michelle, and we were looking at the CASOA data, and housing came up, in-home services and housing and transportation were my top 3. I anticipate that today it will be the same. But I really heard that during these community conversations this round, that the housing was a little bit different. It was people saying, I want to downsize, I want to right size, but I can't, because even if I sold this place or I found a different place to rent, I couldn't move into anything smaller, and it would support my community if I could move into something smaller and then have a younger family move in. Or I'd like to be able to do a home share. I don't know how to do that, or that's not in my region. So workforce and housing are some of my top concerns going forward.
Yes.
I think for us, it was really communication and information. So people maybe didn't know about AAAs to start. And then when they found themselves in crisis, us trying to find any way possible to get the word out about who we are, what we do, and how we can serve folks, both older adults and caregivers, was a huge challenge for us. And I think we did a pretty great job, but I think this was an issue before the pandemic, during the height of it, and continues to be an issue today.
Yes.
So one of our live stream attendees, Eva, was saying supporting long-term care residents and their families was very difficult.
Big issue. Any other? Yep.
It was both a kind of a blessing in disguise, but also a challenge was some of the funding that came during COVID. It was very prescriptive or very directed at the federal level. And I think there were some missed opportunities because of that, where those funds were very prescriptive, and there were regions across the state that could not accept those funds because they do not have those types of programs in their area. And so the flexibility ultimately that we did have with some of the funding and some of the emergency funding did help either to grow programs or meet the increased needs. And those in themselves were also challenges. But that is also one of the things that we found, is that if we had the flexibility to meet the need of our community at each community level, it made a world of difference, regardless of the funding stream or the funding source, out of administration on community living.
It's been really hard. I mean, everyone keeps talking about how much money the federal government's been putting into, all the communities, but when people, I keep hearing this over and over, not only in the older adult network, but in local government, like we're already so overbooked to even take the time to apply for the grants, manage the grants, figure out how to report on the grants, all on its own is a huge issue. So even though the money's there are people accessing it and accessing it properly is still an issue that the feds need to actually maybe figure out. And I think there's some new bills coming out that are going to help with people, their capacity to use grants and for community improvements. But I think that's one of their learnings is that like just because we throw money out there doesn't mean it's going to get to the right people at the right time and do the right things. Not that it wasn't a good thing. I'm just saying, but lessons learned on that front. So let's move on to CASOA. Basically, sorry, the font's a little bit small here, but just to remind you all, it is a uniform survey we've been doing for many years. We try to use the same questions in every community so we can build our national database. We changed it in 2021. Again, like every 5 or so years, I review the tool, and then I also look at all the literature, all the things in older adults, just to make sure we're still measuring all the things that are current. For this newer version, we added a lot more kind of on what Aaron said, like, more types of housing and, whether that's meeting the needs of older adults. We asked more on inclusivity, equity, those kind of issues that are coming up. That's really where we strengthen the instrument. We try not to take away because we already have so many good questions and we don't want to move them. So we had to change a few things, but we tried to fit a little bit more just on that kind of like land use, home design, and then more on equity inclusion in this new tool. So you'll see sometimes in your report, if it says there's no trend line, it's because it is a new question on the survey, but it really is maybe 5% of the items. But again, those have been added. We also, because we did add those new questions, and also because like some of the issues like equity, inclusion stuff have become more important, we've changed the model, and I'll talk about that. But just it's a lot of the same questions, but we've reformatted. So you'll see also in the report, sometimes we don't have, like when we've aggregated a bunch of questions, it'll say no time trend, and that's because we added new questions to that domain, and we don't feel like it might be a fair comparison, because if the new question we added, everybody tends to be positive or negative about, we just don't want to give you misleading information. So if it says no time trends there, and maybe 4 of the 5 questions were asked in 2018, but since that 5th question was asked, we're just saying no time trend. But when you do it again, unless we've added, we try not to add new questions, but if we do that, we just don't think it's a fair comparison. So that's when you'll see no time trend, even though you've done the survey in the past. But anyways, the goal originally was really to identify both community strengths and what we need to so we can support successful aging. We want to articulate the specific needs, estimate the contributions of older adults, and really develop estimates of counts. Not that you guys can't take calculators and figure out, but the goal when we first started was to make sure you could say we have 72,000 people in need of meals, or we have this many people in need of housing. We just thought that would help you a lot with your plans to have those data quantified, or for advocacy efforts, if not with your plan, to basically talk about how many people in your community suffer from a certain issue. The methods, we used a random sample of older adult households, a multi-contact method, sent multiple postcards and surveys to folks, as well as allowed them, for folks who did want to get online, they could do that. And we statistically weighted to reflect the older adult population. The goals of CASOA, immediate, and the reason why we started it was really for folks to do their 4-year plans. But any kind of planning, resource allocation, we also find very useful for advocacy, and also just kind of telling those needs at the state level. And maybe the national level, I might have to send Sandy some information about how we could use our national database maybe to help support her work, to show the needs across the nation, because data can sometimes speak to policymakers. And then really work on just engagement of older adults in the community. Intermediate, is to make sure you guys provide the best programs and services and have the best policies. And then finally is really so our older adults can successfully age in place. That's the end goal, but we have all these others. So that's what the data, that's why we designed the survey, and that's why we helped use it. Next slide, please. So, and we talked about, it's come up already, but really, want to, with the results, and you'll see with these results throughout, the pandemic happened. Say we went from 2018 to 2022 with no pandemic, I don't know how different would look. So when we see all the results today, and actually I was kind of shocked because I thought you might go negative in tons and tons of areas just because the pandemic, how it really affected our communities, but especially our older adults. You could see not only do you have older adults aging, you get more into your population with more services needed, you also had this horrible pandemic that affected older adults more so than other groups of our community, a lot of people would argue. So again, using CASOA as a performance measurement tool about how well you're doing in Colorado, I don't think it's really useful for that given the pandemic. I think what it's really did is quantifying the needs again today post-pandemic. And how those needs will look 3-4 years from now could be different as well. But I just want to say a caveat in terms of all the results it is based on people getting out of a pandemic, and still, some people still really within it. Next slide. And we talked already a little bit about this, but just with the pandemic, and you guys were kind of doing it. But in terms of lingering issues, are there things that really, and maybe this is said a little bit, and it was a little bit like things were coming for us. The pandemic made it happen even more so. But what is the most single lingering issue you think that the pandemic alone has caused? Yes.
Workload increasing and the capacity staying the same.
Yeah, so staffing at the aging network.
There was an additional comment also about one of the challenges being homeless older adults, that population growing along with their mental health issues.
Other issues we think that are strong, lingering issues from the pandemic alone?
There were older adults who accessed services during COVID who previously might not have, and now realize either by necessity or appreciation of those services are continuing to access those services that they might not have pre-pandemic.
So it's a good thing, but it's not a good thing when you don't have enough staff, right? It would be a good thing to get more people into your network.
Comes back to that
yeah,
challenge,
but then it comes
exactly.
Back to if you don't have the staff or resources. But again, and it's a good thing that they came into the network, right, and finally got to know you. Because we've talked about in the past, like often folks who get to know you, it's when they're, it might be a little too late, or it's, the frail times of their life. And wouldn't it be great if people could kind of know more about your services and what you do early on to take advantage of more of those preemptive kind of ways, which is a good thing. But like I said, with people at staff already being at capacity, it just makes a challenge for us all. Next slide, please.
Can I say?
Yes, sure.
So one of the things that we're seeing in our area is when COVID hit, we're the smallest region in the network, and we tend to have older adults that do a lot of our volunteering and working, and so a lot of the programs that they were unable to do, left no food to be handed out because they were the ones who did that. So we ended up taking those on, and here we are years later. What do we do now? We can't keep up this pace. So it's how do we keep those programs in our area, and food is an issue right now. The cost of it, our food drives, or we're just seeing more and more people because they can't afford them. So one of the main lingering things is the price of everything that's gone up. People didn't get more money, and how do they just pay for every day-to-day things, much less how do we keep up with that demand as well. So it's definitely money.
And it makes sense. I mean, all of us are struggling with things like not having enough work, like the workforce alignment, not having enough food, supply chain increases. Colorado, cost of housing, cost of living increases, crazy. And so it's like that affects everyone, but the older adults on fixed budgets were struggling more so. So understanding that those impacts of the pandemic that are still killing everyone else are impacting your folks even more so.
Michelle,
yes.
One more thing. Ageism, lingering issue that we were starting to address before COVID and really ramped up with COVID in every way is impacting everything that we're doing. So.
Makes sense. Okay, next slide. So in CASOA now, we actually basically assess, so you'll see the report's a little bit set up, but like here's community characteristics, like this is how well the community supports older adults, yes or no, or on a quality scale. And then here are the needs you've had in the last 12 months. I mean, there's also participation and status questions, but those are the two kind of core areas of where we ask a lot of the questions. And so for those community characteristics and those needs, we kind of break it into 17 categories, and we'll see those later. And if you get on your report, you'll see we call them the donuts, but there's like a housing donut and a land use donut and an equity donut. But those 17 are all sorted into 6 larger domains. And those larger domains are community design, employment and finances, equity and inclusivity, health and wellness, information assistance, and productive activities. But those are the big larger categories, but within those there's the 17. And so you'll often see a lot of the data in those 17 different areas. Next slide, please. And here's bigger descriptions of them. We also, beyond those, all the different topic areas, we also still have that overall community quality. So this is like, is it a good place to live, a good place to retire? Would I recommend living here to another older adult? So those are just those over kind of omnibus questions about your community. And then so community design, what's in it is housing, mobility, and land use. Employment and finances has employment and finances. Equity and inclusivity has equity and then in community inclusivity. Next slide. Health and wellness has safety, physical health, mental health, healthcare, independent living. It's kind of the largest category just because we have lots of questions around that. Information assistance has the quality of older adult services and the information available to older adults. And then productive activities talks about civic engagement, social engagement, and caregiving. So those are like the productive activities. And then in the economic contribution, we are going to mix the employment with the productive activities, you'll see. But so we do sometimes cross those domains. But generally, that's kind of the way we sort the information for you all for your reports. Next slide, please. That waiting table is really small font. But just so you know, this is the document if you want to see the waiting table. We used a multi-wave, multi-mode survey. We mailed out, we ended up with 161,000 going out, 23,000, or almost 24,000 being returned, which is a response rate of 15%. It was 17% to so not a big decrease. We saw a much bigger decrease from 2014, I think, to 2018, which is interesting, but that's good. And then again, we always statistically weight the data, reflect the greater population, because we just know, for instance, males don't turn in surveys as much as females, so we kind of have to weight some of those things to make it more representative. Next slide, please. We also have the National Benchmark Database. So one of the things we think is important at NRC at Polko is giving you comparison data. And what I love about the way Colorado, you guys being the pioneers and doing the statewide, but it's not only do you see what the percentage you get, but how do you compare to the nation? And you guys also can compare to Colorado as a state. And I think that just gives you context, because we used to always get data back that would say 70% of people feel safe. And we're like, should it be 90%? What if it's 50%? So like that data, it's not basically telling you you're doing poorly or great, but it is giving you some context to the data about how, if that's a common, and you'll see we have a lot of people with this need, but nationally there's a lot of older adults with that need. It just helps you understand it better. And so basically we tag within the report whether if you're 20 points higher than the national benchmark, then you're more favorable. 10 to 20, this is much more favorable, 20 points. More favorable, 10 points. Similar, plus or minus 10 points, we consider that the same. Then it goes less favorable, 10, and then 20. Now, the one thing that we always do say, the people who will do our surveys and actually care to spend the money and ask folks tend to be higher performing organizations. There are people who will never ask their older adults for their opinions. There are people who, and it may be because they don't have the money, and it may be that they feel like they actually know the answers themselves. But often being on par with the nation is not a bad thing, just because we can't have national data. I can't make people do a survey that don't want to do a survey. So just so you know, being on par with the nation sometimes is actually pretty good. Also, let you know some of the data. So the needs data only comes from older adults in our older adult surveys. All the community characteristics data that are not very specific to older adults, we actually do a national community survey where we actually survey hundreds and hundreds of communities across the nation, have millions of people in this data set. And what we do in there, we go take all the people, 55 or 60 and older, and pull all their data. So those national benchmarks are based on all kinds of information from across the nation. But we have this data, and again, it's one way to look at your data, but there's multiple lenses that we're going to look at the data today. But just so you understand our benchmark database, that's how our comparisons work. Next slide. We also have trends over time. And basically, so I want to talk to you about the fact we actually, when we did it this time, we were using plus or minus 7 percentage points, which is because some folks in our office felt that we should focus on policy significance. But in your 2018 report, and I was just looking at this yesterday because we just got the reports yesterday, we did it statistically significant based on math. And so I've asked our people to go back to do it the way, just so you're consistent, it's mathematical. I'm going to show you today the difference between what are the 7 percentage points and what are the 2, 3, 4 percentage points. One of the conversations that comes up, so there's a mathematical way to to calculate margin of error, and it would be 2%, right, based on your large sample sizes. I often talk to people, and I think this is why maybe it got lost in translation to the people doing this, is just because it's a 2% difference, that may not mean policy significance. Sometimes I use like more 5, 6, 7%, like as a policy significance cutoff, because it's like, so if you went from 50% to 52%, it's statistically significant, especially since you guys have a huge sample of people. There's numbers that make that go into account. But do you want to do something about it? Maybe those that are 5% might be something you want to do more about. Now, the thing why it makes a difference with the 2 versus 5, though, it might depend on their baseline. So say it's 50% of people saying they're having a problem with staying physically active, and it went from 50% to 52%. Does that make a big difference? I would kind of say maybe not. But say it was being a victim of crime went from 3% to 6%. That's almost doubled because it was such a low prevalence. In that situation, I think that is policy significant. So again, I'm going to ask them to go back to the way we did it in 2018, the mathematical way, just because it's more justifiable. But I want you to know when you look at your reports, that 2 or 3% may mean it's something, and it may mean not. Does that make sense to you all? Just to understand. So you can decide in your own community if those changes are significant enough to make changes around or decisions around. And one of the things too, since you have 3 years now, that's a good thing I look at too, because sometimes if it's only a 2 or 3% change, but if it was 2 or 3% change growing from 24, if it's now continuing, that means a lot more to me than if it's like doing a mountain or a V. So you may want to, and you can click on all your pieces of data. So if you see something's changing over time and you're interested in it, just look at that time trend and decide, is that really significant for us? Or is that something that's interesting and we're going to follow over time? But again, because you have such large samples, I just don't want you to make a big deal over some things that may have just changed slightly due to, with everything with COVID and everything that's been happening. I just don't want you to make too much of a big deal over some of those differences that are maybe not huge. But mathematically, I want you to have the right data, if that's okay with y'all. So they're redoing the reports, so you should be getting them very soon. But just so you know, consider the ones you have now, your draft reports that are policy significant, maybe. And these will be the ones that really have more comparable data to 2018, so you see that same time trend, if that makes sense. Next slide. So let's start out with the data now. So we asked them what to rate your overall quality of life, and we got about 88% saying excellent or good, and actually it was higher than in 2018 by 5 or 6 points. Now it didn't, if you see your report now, we'll say not, but it is 5 points, so that's higher, and you're similar to the nation. So that's good news. Now the one thing I want to talk about, you'll see a couple of data in here, and I'd like to get your interpretation on it, but a few of the things that I would have expected to see decreases have increased, but what we've noticed in our other survey data is, I don't know if it's like a halo effect, but people were kind of comparing themselves to if you're saying, how do you feel, are you less isolated or depressed? I feel like in some of our other survey results, people are actually being more positive than I think maybe they should be, but because they're comparing themselves maybe to 2020 or so it's not like we're saying, compare yourself to 2018. How's your mental health? Compared to 2018, we're saying, do you have a problem with this? And they might be thinking, well, compared to a year ago, we're much better. We have a lot of communities saying, our economy's great. And we're like, well, your economy's probably not as good as it was pre-COVID, but they were thinking about 2020 when everything was shut down. And so again, their perceptions, but hard to understand how COVID's playing into this data, but we do want to kind of take it into account of what they're saying. But anyways, they are saying their quality of life, we got to increase. So next slide, please. Now we'll look at overall community quality. So those are the community characteristics we asked, about 50 or so different ways, and these are all things we found through the literature and through work with you all to support successful aging. Next slide. But first, we're going to start with the more general findings. So your community is a place to live. 84% of folks rate their community positively, similar to, almost identical to 2018, and similar to the national benchmark. Your neighborhood is a place to live. That's a new question. About 85% still rating their neighborhood well. Overall quality of life in your community, about 8 in 10 saying excellent or good. And then your community is a place to retire. We always see that drop quite a bit more, 66, so about 2/3 of folks, and that's been very similar. So we haven't seen a lot of changes from 2018 in those data, and you're on par with the national benchmark. Another one thing we often talk about is people are like, oh, if 85% of people are great, what is the issue with older adults? It's like, well, what about those 15%? And so, we have to think about, and we'll see disparities, and you can see them more in the reports later in the needs, and we'll also, if you get online, you can see the disparities more, but understanding who those 15% are, whose quality of life is not good, is a lot what you guys actually are focusing on, right? Yeah, is there a question?
There was a question regarding some communities have small samples, so what would be the best way to consider those pieces of data?
So we will actually, and what we're doing is today we're actually having someone on our staff for every single community do the margin of error based on that actual numbers. So they will get also a margin of error. So you'll see, and actually if your AAA report, if you had a smaller number, your actually margin of error at 7% might be the same thing. In fact, a number of you are. But for the really small communities, we're saying counties. We should, if you have a smaller number, we're saying, you're going to probably have a plus or minus error of 10% or something. So you're going to have much fewer. If you had time trends, you're going to have fewer than if you're Dr. Cog or, some of these groups that have really large samples, you guys are going to have the bigger the sample, that smaller the margin of error. But it will be customized to each community. so that so it may not be the same. So if you're in San Juan versus Weld, you won't have the same margin of error. We're going to make it mathematically correct if that works for y'all. Okay. But it will be in your report and it will be flagged that way so you'll know what's above or below. But again, I would encourage you to click on it and see the trend, just to see if it makes sense to you, because we're saying above or below, but you can see, oh my gosh, that one was 15 points. Oh my gosh, that one's 3 points. But if you're a smaller community, we expect that to be more wild in variability because that's just the way it works with sampling. So the larger the number you have, the more we expect that line to be very smooth. And if you see jumps, it's more likely to be true versus if you have 30 people in 2018 and you have 30 people, that's more variable, if that makes sense. Next slide, please. We also ask these kind of tell questions, which is how likely are you to remain here, which is really important for you all to understand. And we've got 8 and 10 plan to stay in their community throughout their retirement if they can. And that's similar to 2018 and online with the nation. And about 7 and 10 would recommend living in their community to older adults. And again, similar to 2018 and similar to the nation. So about 7 and 10 saying 8 and 10 saying I'm going to live here, 7 and 10 saying they tell another person to live there. But again, who are those 30% who are not saying? Next slide. So community livability. Here's where we're going to get into this community characteristics more, so dig deeper. Next slide. So again, it's those 17 different aspects of livability within the 6 domains that we already talked about. And I should tell you some of these big notes, why it's kind of, we say it a couple times, we've made the slide deck so you could actually cut, you can pull those, so if you're the person giving the presentation, you don't have to look at your notes and say, oh wait, how many donuts are there? How many? So that's actually kind of an aid for you all too, as well as so the speaker can do that if they want to. But so as we did in 2018, but now we have new categories, we basically we average all the questions within each of those domains or sets of questions to give you a score. And I'm going to come over here just so I can see this, sorry. But basically, so on a score out of 0 to 100, how did you score overall? So for Colorado, your overall community quality, you get a 66. That's your highest score. But if you start to dig into those 6 areas, you basically find that the areas where you're doing the best would be, here's a 47 in productive activities. You get a 45 in equity and inclusivity. The areas where you're scoring the lowest, employment and finance is a 26 on 100, and information and assistance, a 30. And this is always an issue. We're going to talk about this later, I'm sure, but communication and information, as hard as you guys work, it's really hard to do it well. And also, you let people know about stuff, now they want even more, right? So it's kind of like this vicious cycle. Next slide. So here are what I affectionately call the donuts of community livability. And so when you can see it in your report, but you also, if you want to see all the questions on housing, you would click on this and you'll see not only all the community characteristics, but you'll also see all the needs related to housing. So everything we have on the survey related to housing is beyond that donut click. And you'll also then see in the report it also does the same thing. But if you don't want to dig through the PDF, you can easily just go in there and click housing. So basically we again, within now those 17 different areas, we've actually done these averages on 100-point scale. And so where you see some of your highest scoring items, again, you see some of them in the 60s, and that would be social engagement is a 62, safety is a 68, physical health 64, mobility 62. Where you see those low scores, housing 20 out of 100, mental health 31, independent living 29, employment 28, information assistance 33. But some of those are the areas where your scores are the lowest. I know. And like I said, we can compare the ones, see some of these can't be compared because we added questions in them, but the ones we can, the information assistance was the only one that came out kind of as a downward trend. Yes?
So is there a comparison from urban to frontier or rural that we asked for that like in 2018 with kind of a breakdown?
I don't know if that's a crosstab, but we can definitely put that, we can add that if it's not in already. As long as we can categorize, we'd have to do it based on the county level data probably. So if you could, that's the only problem. And
I know the numbers would be skewed because of the population difference in the
but
variance.
if you feel like if we could have a list of the counties or the cities, everything that we have coded, do we have it by city too? Not all cities. Like I said, it's hard to say some cities, can you say urban, rural? If you guys, we might be able to pull it from the census, but it's not that great sometimes. If you guys want to go through that list and say, we would call this urban, we would call this rural, we would call this mixed, if you want mixed category, or if you feel like you could really do that, we could actually add that as a field and and make that a cross tabulation like the Colorado State report. But we'd have to have, I think, that data.
Right.
Is that hard for you all to do if you think about your own
We break down
AAA?
counties already now in rural and frontier and urban now.
So if we use the county sorting, you'd be okay
The
with
county
that?
sorting would be fine. It was just to see how the
Okay.
living aspects compared to urban versus frontier, rural, whatever. The communication, I obviously know that I'm going to be skewed way off because I have less communication in frontier or
Right. Well, all the
different
stuff
area.
could change, right, by frontier. So yeah, if you're comfortable with us using, and this is from the census designation of frontier, because I know I've had to do these analyses before, and there's like 8 different ways people decide this. But if you guys let us know the way you want that categorized, if you know the source, and we can pull it, we can make it one of those crosstab variables on your report.
I appreciate that.
Okay.
Michelle, I feel a little bit bamboozled because with the first slide, I was like, "Oh, look at that! Those aren't bad numbers. This is way." And then you hit us with the donuts, which we should. Donuts are wonderful and delicious. I feel like we should call them like, I don't know, rings of death at this point.
But now we're going to dig more into the data. We don't, like I said, but unfortunately we don't have the national benchmarks yet because these are new codes. But we'll dig deeper. So don't get too depressed because I think nationally, I don't think like once we get this score. Mental health for the nation. I mean, it is depressing for the nation. I'm just saying, because I don't think you guys are that far off the nation in a lot of your data. If you see the independent measures, there's not a lot where you're that far off, just so you know. So this is a picture of the nation, quite honestly, not too different from the nation. So yes, it is depressing in that. It is, I get that. But at the same time, we'll see individual items within these categories that are going to be positive. But yeah, but yeah, I mean,
I did. I mean, I really, when we saw that first slide,
well,
I was
people
like,
still
wow.
are, that's the thing is, but they still are happy. They like where they live. Their quality of life is pretty good. That doesn't mean their community is supported. These are community supports. This isn't their needs. This is how well is our community doing at things. A lot of times they're giving ratings of not so good, you know? And you guys know that's, I mean, mental health, and the mental health one is about mental health services in a community. And we all know nationally there's not good mental health, you know? And mobility has to do with, it has, walking, opportunities for bicycling. Like some communities do great at that, some other. You also may be in a community that has terrible traffic. So you're not going to get scored high. Housing, huge national issue. I think Colorado, it's probably more extreme. But again, I'm so excited, like within the next 6 months, we'll be able to have benchmarks. But since these are new, we don't have benchmarks to give you. But I'm just saying that like if you think about these are services providing older adults, it's not necessarily saying these people's lives are suffering because of them, but they're just giving you ratings and they're not saying excellent and good to a lot of these things that we want to support successful aging.
How can you say though, how can housing, which I think looks like the lowest ranking out of all of those, housing is at 20%, but then that slide was like, 78% of people thought that this was a great community and 71% said this was a great place to retire. Housing is like the foundational piece of your community.
And some of the questions it's like the availability of affordable housing. They made themselves, like again, we have the needs questions, that's why we have the needs, which is a different look. Are you personally experiencing housing needs? That's different than, do you think our community is good at affordable housing? How many communities in Colorado, how many of you think you have a community that supports affordable housing right now? How many of you think you have housing that supports people with multiple needs? They're being honest, right? So that doesn't mean that, but that's why we ask the resident needs questions. So how much, you can say the community sucks at this, but does it affect you? So the needs is kind of probably more, I do think the community quality questions are really good, and those are the kind of conversations to have with policymakers, council members, mayors, the business community. These are things we need to build in our community to help folks. The needs section, which is going to follow, is a little bit more like, for our plan, this is how many people have a housing issue. Does you see the difference between those two things? But they're both really important. We need to build our communities up, but we also are quantifying the exact need right now. So like I said, I can say in my community, I live in Colorado Springs, I live in a house and I don't have an affordable housing issue because I already had my house for 10 years. But if you ask me if there's good availability of affordable housing, I'm going to say no, right? Does that make sense? But yes, but I do think it is supporting the need for all communities across the nation and across Colorado to start working on these issues, because at least through the literature and all the stuff I've had through conversations with folks like you, these are all things that are important for people to age in place. And if we're not doing a good job on it, it's just going to get worse and worse, right, as the older population grows. Does that make sense? Yeah.
Michelle, would you share there in the third column there, the productive activities, caregiving, and that note?
Yes. So caregiving, we don't ask questions on the survey that we only affect, there are not enough people to actually answer it. So we didn't ask a question on the survey that says, how is caregiving in Colorado? But we wanted it to be a donut so you can click to all the caregiving needs and the other status questions. So it's kind of an interesting thing, but we just couldn't write a question and wanted to add to the instrument that everybody could evaluate on it. But caregivers answer these kind of things. So that donut is there more honestly as a placeholder for you all. So there's one place that you can go to each donut. So you click on caregiving, but you'll see a bunch of data, but it's on their needs and also how much they provide care, all those kind of things. So we don't want caregiving missing from that if you start to use this as your guide for the report of how you get to the data. Does that make sense?
Yeah, thank you. That's good to know because as we all know, caregivers sometimes don't identify as caregivers,
Right.
and so that could be another area
Yeah.
that data would be skewed.
Right, and so we had a discussion because we were afraid if we asked about caregiving and they're not getting any caregiving supports and doing things, they might decide to answer. We just didn't know if it was worth because we were trying so much to fit the survey questions on 5 pages, and so we're just like, let's not make a lot of people who don't even understand what's out there give us their response. If they're telling us they have caregiver burden and other things on the other issues, we're going to focus on those data for caregiving because we wanted to get more into, because we like that economic contribution, we really wanted to ask some of those caregiving questions. We wanted to dig deeper in caregiving in a different way, and so that's how we did it on the survey. But again, in a perfect world, if I had 10 pages of questions, I might do more with caregiving. But because we could say, if you're a caregiver, then rate the services, but again, that, it's just takes up a lot of space and then has instructions for older adults. I don't love a lot of skip patterns and instructions in the printed surveys. Next slide. So I'm going to talk about, there's 3 ways we look at the data. First of all is just where did you guys score highest and lowest? So the most percentage of people saying excellent and good. And then also the lowest percentage of items where you're doing excellent and good. We're also going to compare the national benchmark when we can, and we're also going to compare time trends. So there's 3 ways to look at your data, because the goal of this workshop kind of is to identify needs. Even though, again, we want to talk about the strengths and all the great things that older adults bring to communities, the goal of this workshop is a little bit to identify what areas we need focus. So we're just looking at the data in 3 different ways. So the first one is these are the areas where 7 in 10 older adults say their community is excellent or good. Ease of travel by car, ease of getting to the places they want to visit, opportunities to attend religious and spiritual activities. So those are things that a lot of people are saying is really good in their community. 60 to 69%, still pretty high ratings. Ease of walking, fitness opportunities, opportunities to volunteer, ease of cycling, and recreation. So those were 6 in 10, 7 in 10 are saying their communities are good. Next slide. Here's the areas where fewer than 1/4 of folks said excellent or good in their community. Variety of housing, variety of employment opportunities, availability of daytime care options, cost of living, availability of accessible housing, and then availability of affordable quality housing. So does this make sense? Now you can see why the housing scored so low, because these are some of the lowest scoring items on the survey. And I don't know if anyone thinks any of those are shocking, but that's the areas where people are saying their communities are not excellent or good. Yeah.
Okay, so the one thing that I think is shocking in this is the variety of employment opportunities. When we walk around and see hiring signs all day, every day, may I make the assumption that the employment opportunity is for something I'm looking for, salaried, skilled, something more than...
I think that's probably one of the assumptions. I think, and I have a whole new enthusiasm because I keep going to communities where they can't find employees to help anyone. But I do think a lot of the employers aren't making the connection. I think a lot of the older adults, there's not the bridges created. And maybe in your communities you're doing a good job, but I feel like older adults might want jobs, but they have to have the right kind of jobs. They might not have the skill. We have a total lack of workforce training across the state, not for older adults, but anyone that wants to move or try to learn to do a new job. Right? So, but I also think we know with the baby boomers, they tend to want to have jobs that have meaning, while the older adults were a little bit like, I'll be at Walmart to hand out the cart, and that makes me feel good about myself. The studies I've read, the older, baby boomers are a lot more like, I want to do something that's really, more who I am and what I do. But I do know that with all the workforce alignment, the lack of jobs and skill training and the lack of the employers being able to onboard people, look and market for a new population. If you're advertising all your jobs on Indeed, how many older adults, like the baby boomers, but my parents aren't looking on it Indeed to see if they can find a job. So I do think there's a huge opportunity, and I don't know exactly how it works, but I think there's a huge opportunity to figure out how older adults play into our whole workforce challenge in all these communities. But I don't think, like I said, they should feel like there's more jobs, but I still feel like there's still a disconnect of getting the people with the right skills to the right jobs. Just because a lot of them too have technology, and if you're not technologically trained. There's some of those skills that need to be created. Yes.
There was a comment that maybe they weren't hired because of ageism, despite the signs of open positions. Right. And then also that employers are not targeting older adults, as you had said.
Right. And give them the right kind of, and in general, a lot of employees feel not supported because all the employers are so rushed and they're not onboarding people. And I think with some of the older adult, they might need a little bit more onboarding or different kind of onboarding, especially if you've been out of the workforce for a while or, been trained in something very different than you're going to do now. So I do think people looking more closely, and I do think there's ageism is obviously there. But I know that some places I think they're so desperate anyway, sometimes, around in Colorado Springs, I really think it is a good time for the older adults to get into the workplace, if they can, yeah.
There was a further comment after that saying that possibly the diversity, equity, and inclusion work doesn't include ageism, and it really should.
I think you're right about that too. I think people are very focused, especially on ethnicity and race, but not so much on age being an issue. And also just people not understand the resource that the older adults can fill in their communities. Because one of the things you see a lot, especially these mountain towns and stuff, no one can afford to live here, but if you already have an older adult who has a house and can live here, what a great solution is that? Because a young person coming in can't afford to live here, but this person already has their mortgage paid for, bought the house when it was much cheaper. Why not use that resource? It seems to me like that would be a natural fit if we can just figure out that alignment. Next slide. So, but when we compare you to the nation, that's what I'm saying, 0 times were you better than the nation. Most of the time you're on par with the nation, so that's why I'm saying your donuts are the donuts of America right now, mostly. There's 5 areas where you received less favorable, and I'll show you those now. Quality of employment opportunities, cost of living, availability of affordable quality housing, variety of housing, and availability of affordable quality physical health care. So those are the areas where you are significantly lower than the nation in terms of your ratings. Next slide. Now here's the trend rating slides. And again, this is based on Kim, Jade, and I doing recalculations last night of all your, so it's not going to match your reports exactly, but it will in a few days. So in terms of 2018, in 7 places you were the same. 11 areas you moved up, which is amazing. But again, if you look at the older reports, they're all 2, 3, 4 points. So they're not huge increases, but still, statistically, they are significant. And in 15 places, you went more unfavorable. And again, COVID is such a factor in these trend ratings, but we'll look at these nonetheless. Next slide. So these are the areas where you scored higher than in 2018. And again, all these are probably 2-3% difference, so you can take them as you want. But ease of travel by car, that was 7% higher. And that's actually a silver lining of COVID a little bit, because teleworking, we're finding that across a lot of communities. People are, flexible work schedules, teleworking, we don't see the congestion, and those kind of things, and just they're thinking back, but there are not as many people out. So that was the boon of COVID is, air quality and car travel got really good for a few years. Overall quality of life, that's what, availability of quality physical health care, even though it's lower than the nation, it did increase. Ease of walking, your overall physical health, finding work and retirement, availability of affordable quality mental health care, ease of travel by bus, neighborliness of your community, availability of preventive health services, availability of long-term care options. Now again, this is the thing I was saying, we'd see that kind of halo effect. So are they comparing, we're not saying compared to 2018, we're just saying how would you rate it now? So even with the long-term care options, they're well, a year and a half ago I couldn't even get in. But so now the long-term care is better. Or if we were in long-term care, we were in lockdown. So again, it's hard to really understand. And again, these are all 2-3% increases. So no, they're increasing, they're at least not going down. But whether that's significant, I think we'll know more in the years to come. Next slide. Community characteristics scoring lower than 2018. So these were the areas, and actually, these were all ones that actually were 7 point and above. These are big ones. But if you look at a lot of them, now not quality of employment and cost of living or food, those are really important information. But a lot of these, recreation, fitness, volunteer, think about it. Because of COVID, could they do it? Right, so almost all of these in these areas we're seeing across the board because they just couldn't do them. You couldn't be live, you couldn't be in person, so you can't say, our communities just suck at recreation now. It's just they could not go to the fitness facilities they're going to. The ones that are less related to COVID, quality of employment, cost of living, and food, availability of information, valuing older adults in my community, that's the ageism piece coming up, availability of daytime care options, financial legal planning, and safety. And we know it's not just older adults feeling the safety thing. We feel safety across the nation. People are feeling less safe than they did a few years ago before COVID.
Hey, Michelle.
Yeah.
That's a question on the last slide, the one about availability of long-term care options.
Yes.
So I want to be clear, this survey does not go to residents of long-term care,
No,
correct?
that's true. So this is people who live in the community. It does not go to group quarters.
Okay, and it's
So we're
overall
not asking people in group quarters how well they, but like older adults in the community rating, so
Okay.
they may have been in a long-term care and came out during COVID, or they might be someone trying to get into long-term care, but is not folks in a nursing
people
home.
with the knowledge of long-term care, not the general community responding to the availability of long-term care options.
It's older adults not living in group quarters right
Okay.
now.
All right.
And the way group quarters defined is really how your mail post office works. There are some kinds of group quarters that are like independent living. If you have your own address, you'll get a cert. But if you're actually in the nursing home facility, rarely they don't have their own address, right? So
Yeah, so when you say group quarters too, so this doesn't have to do with this, but are we talking about maybe folks in recovery too wouldn't be necessarily answering this?
Anyone who, if you think about the post office, if anyone who doesn't have an address, quite
Okay.
honestly, so it's prisons, universities, nursing homes. But independent living, if you have like my parents live in independent living, they have an address, they get mail, they could have received it because they are just a older adult. But if it's going to, we don't know which room you're in, you're not going to get that survey.
Okay.
In the first years we did it, we'd try to take them to nursing homes and have them help us fill them out. And it took a tremendous amount of resources, and we didn't end up with a lot of good data. But we did earlier on try to include the nursing home folks, but we decided it was just too expensive for what the data we got back, unfortunately. Okay. Next slide. Okay. Now so that was about their communities, right? So what was doing well, what was not. Now we're going to talk about challenges. And again, we're asking them to self-report in the past 12 months how much this has been an issue for you. And again, this is impacted by COVID in the way that like the last 3 or 4 months might be a little bit different than the 6 months before that. But they're kind of reflecting back on the past 12 months, however they choose to do that. So again, we just have to take COVID into account with all these data. Next slide. So we actually gauge 42 specific problems and challenges that we find are common to older adults. And we put those in those categories of need, the same ones. So here are the challenges that older adults, more than 50%, reported either having a major, moderate, or minor challenge in the last 12 months. And you can click on the data if you want in the report, or even see the full set of responses to see the major versus minor versus moderate. But there's the scale of gradation. So more than 50%, and this happens in every survey I do with older adults, not knowing what services are available for older adults in your community. And like I said, I think last time we had a lot of discussions about this. Like, it doesn't matter how well you do it, they're still going to say there's not enough information. And partially it's, the federal, you guys are held accountable for all the federal information. It's not just what's happening at the AAA level, but I think they also conflate Social Security, Medicaid, all the different things that have to do with it, and probably with COVID also. Like, was there help out there they could have received and assistance? That's not you guys' job, but I feel like you're probably held accountable for it. Doing heavy or intense housework, maintaining your home, having adequate information or dealing with public programs such as Social Security, Medicare and Medicaid, maintaining your heart, and physical health. And a lot of these were the issues we saw in 2018, but those are the areas where at least half your folks said they've been having a challenge with it. Next slide. We also have 40, 50%, because that's still quite a few, 4 or 5 out of 10 are struggling with these issues. Staying physically fit, and it'd be interesting, we never asked that question with younger people, but I would have to, I'm 55, so I could be older adult. But I think even if you ask 30-year-olds, they might have issues with staying physically fit. Staying physically fit, feeling like your voice is heard in the community, having enough money to meet daily expenses, having interesting social events or activities, building skills for paid or unpaid work, maintaining a healthy diet. So 4 or 5 in 10 of your older adults are saying they have issues with that. So that kind of goes, that's building skills, kind of with the employment hand in hand. Next slide. So when we compare your needs to the nation, though, you're actually on par. So again, you look like the nation. Yes, so as I said, low bar, right? Next slide. And you can look at the data, and but there's nothing more than 10 points. You could be, 7 points different, but we're saying that cut point is 10 points, so nothing exceeded. Now here's the part where, and again, this font's very small, but in your own report, this is where we really hope people can use this in their plans, where we basically say the percent of older adults with that need in all those different categories we talked about, and then we actually take it with the state population, or with your report. If you're getting your own report, you'll have it so using the most recent census data we can get, you have those numbers. So if you want that just to put either into your plan or to advocate to say we know, or to plan services. We have 40,000 people in need of this service right now based on their self-reports. I think it can be very useful data for how you plan and do your budgets or make your arguments. But again, you can't see this font very well, but okay. Now, comparing to 2018, we basically find in 10 places the percentage of people rating a challenge was similar. 9 areas, they have fewer challenges, and in 16, they have more challenges than 2018. Next slide. So here's the needs decreasing from 2018, and besides these top couple, these only changed about 3% or 4%, but they did increase, like there's positive room in this in these data. Feeling like your voice is heard in the community, and I've seen this with the other 2 older, the big statewide ones. We also found those positive, which is interesting because you see like valuing people is going down or low, but feeling like their voice is heard, we've seen in a couple different places. So I'm not quite sure what that's about. Interesting trend, but it's happening in Colorado. Staying physically fit has improved. Your physical health has improved. Again, this might be compared to 2020 too. Like we're a lot healthier than we were when, with the virus not running rampant. We also have people saying they're feeling less burdened by caregiving, and that's another one which is interesting. And does that mean because in 2020, 21, when you're isolated doing caregiving, does it feel different now? You might be able to have a little bit more help. Again, and only changes 2-3%. Not huge changes, but not going downward. Feeling bored, they feel better. Maintaining a healthy diet, better. And less people saying they're feeling depressed. But again, I just do wonder what they're comparing themselves to. Like they may have been more depressed in 2020. So right now, my outlook on life is more positive. But again, I don't have any data to justify it except to say, as we watch these national trends to see what's happening, that's where we saw some positive changes. Next slide. So here's the needs that we're increasing. These are more than 7 points. So these are areas where we do see significant changes in terms of people reporting having a challenge with this. Having enough money to pay your property taxes, having housing to suit your needs, maintaining your home, maintaining your yard, having safe and affordable transportation available, building skills for paid or unpaid work, having adequate information on public programs, not knowing what services are available in the community, and being a victim of fraud or scam. These are areas where we saw pretty significant jumps, so I would consider those pretty meaningful in terms of where those fall. Next slide. And here's other ones we're going to add in if you have the 2 to 5 point. Heavy or intense housework also, getting oral health, getting vision care, having enough food, having enough money, falling or injuring, being a victim of crime. Those also, more people reported needs, but they're more like 2-3% reporting need. Next slide. So there's disparities in responses, and we all know this already. You look at age, you look at gender, you look at rent-own. Rent-own's always a huge one. But we have that, like you'll see some of it, and we have the report where we break the needs by some of these demographics. But again, the thing with the survey being put on the platform, we now have a lot of ability to break the data in a lot of different ways, and we can put urban rural in for you, so we can also start to see data in different ways. So those disparities, because again, we have that 70-80% who say their quality of life is great, but we really want to look at that 20%. We want to look at those people. And even if something doesn't affect a huge percentage of the population, we like being a victim of crime or not having enough food to eat, we do want to know who are those folks that are really struggling with those issues so we can plan our services accordingly. So what we found, and it's what we found in the past, needs tended to be graded for if residents living lower income is a huge factor in terms of how many needs you have and the issues you have. Renters, and we've talked about renters kind of being a perfect storm of all kinds of issues, that it's not necessarily that you rent that you have more problems, but it usually means more transient, lower income, having some housing, those kinds of things. Older adults living alone, people who live alone in households tend to have more needs, and then older adults of color tend to have more needs. The thing that is interesting that has changed is the age one. 20 years ago when I would do this, almost always every need increased as you got older. Now, in some of the areas, you'll see some of the older adults, they're actually happier in some of the different areas and have less needs. And I don't know if it's because maturity with life or wisdom, your expectations have changed, but you should look at your own data and see, but not in every area being older means you have more needs now. But you can see the ones with physical health, health care are obviously going to increase with age. But some of those things that have to do with like emotional health and all those kind of things, we see in some communities, they feel actually better than some of the folks who are younger, older adults. Next slide. Economic contribution. I know you guys use this data a lot, but when we first started doing CASOA, one of the main things they told me is we're tired of people always thinking older adults are a burden to a community. We don't want the whole report, even though our whole goal is to identify needs for our master plan, we want to understand, and we want policymakers and other people to understand what older adults give back so that they actually want to make communities more livable for older adults and keep them here. Next slide. So we basically add together what they do for paid work, how they contribute to the economy, and also how they contribute to the economy through volunteering, providing informal help to family and friends, and caregiving. So we try to quantify the cost of all these activities based on what they tell us they did. Next slide. And so this is what we do, and so we calculate, so we get like the average amount paid for those different kind of services if we outsourced them, multiply them by the numbers and how many hours they work, and it's a complicated formula. And what we found is you did see an increase from 2021 to 2018, but I believe if we not had COVID, I believe that increase would have been more significant because you have more older adults, more people doing things. But because they're quantifying what they did in the last year, people who volunteered may not have volunteered. People who worked may not have worked. So I think it's making your numbers, I mean, still a great number there. But I'm just saying, ideally, I think if COVID wasn't here, that number would be quite a bit different. And so I've talked to Aaron, and we're going to see if there's methodologically, if we can look at that a little bit more and see if we can kind of take some of that COVID out. I don't know if we can, but just know whenever you're using these numbers, I think it's an underestimate of what's happening now in 2020. You know, as the pandemic wanes, people are going to go back more to volunteering. They're going to do more work and those kind of things. But the way that we calculate, it's based on the last 12 months. So if they had not been doing what they're doing in the last 12 months or doing it as often, that's going to impact all your numbers. Yes?
There's a question in here. Were the other states that had CASOAs done earlier, it would be good to know to see which states were being compared to?
Yes, so in our national database, so some of the stuff is based on data that's all for the whole nation, those characteristics. The needs are based on Colorado, Indiana, Montana, and then there's lots of counties scattered throughout the US. So that is one reason why you're kind of part of the benchmark, because you're a big part of it. But we have a bunch of like Fairfax County and Avenida. We have a bunch of different like individuals, but in terms of states, it's only been, you're the third state to do it in 2022. I mean, we have benchmarks from further back, but with the 2022 data, you have those three, but we're about to add California, New York, Kentucky. I mean, our goal is to get as many as we can so this database becomes more robust. Okay. But Colorado is part of the benchmark, so when you're comparing yourself, that is one reason a little bit why you're not totally different, because you're actually part of the benchmark, which actually makes me feel bad for some other states that really do poorly because you guys are part of the benchmark. And so, anyways, does that make sense? But I would love to have data for more and more. The more communities that do it, the better we're going to feel about it. But next slide, especially because we just don't know COVID impacts. Moving forward, so before, and next slide, please. So we're going to do have a group discussion about the results. But before we actually do talk about the results themselves, and we've already had some during this, are there any questions you just have about the survey? Not really about the data, but is there anything you want to ask just about the survey overall or in general that you haven't asked? Okay, and it might come up. So what I want us to do then is debrief the results. And these are, like I said, if you do this back at home with your own groups, 3 of my favorite questions to ask people whenever you see data. So first of all, which of these parts did you expect? Which parts were surprising? And then are there areas we really need to dig deeper? So we're going to have a group discussion now for a little bit just to kind of make sure that they make sense to us. And if they don't make sense, do we need to dig deeper or something? So let's start with, what parts did you expect? Pardon? Housing. Yeah, can you say it in the microphone?
Housing.
Yes. Okay. Housing. Other things you expected? Okay, then what were surprising, which is probably the more important question. What surprised you? I know, Aaron, you talked about the employment opportunities. We would think that would be a lot better just because there are more opportunities. So other people find that surprising? A little bit. What about cost of living? Any things that have to do with finances? Does that affect, Yeah, you want to look at some of the data for a minute, just kind of preview a little bit?
I think along with housing, the opportunities for recreation and physical activity being positive in Colorado is totally expected.
Yeah.
So.
Yes. Yeah. So here's the needs Like, so property taxes, that's related to the cost of housing, right? So having housing to suit your needs, issue in your communities. Home and yard maintenance. And that's what, when I first started doing CASOA surveys, it was interesting because those came out to be the number one needs in lots of communities. I'm like, I never thought about that. I mean, I was young. I was like, I didn't realize how important those kind of services are. But the fact is it's always been a big issue in Colorado and everywhere, but also the fact that it's increasing. But again, it may be, I don't know, I mean, the workforce alignment issue is a big thing. So even if you had like a neighbor kid who would come do something, maybe that neighbor kid is now working at In-N-Out Burger for 20 bucks an hour. So like, so it may be that there's not anyone to help you do. I mean, I can't get anyone to help me do handyman work at my house. And so I don't know if that's part of it as well. Having safe and affordable transportation available. What do you guys think about that one? I mean, some of the stuff shut down for a while, right? And I mean, Uber and all those, I don't know how many people are using, they'll ride shares, but those are really hard to get on, or you're paying exorbitant amounts to get on the ride shares in a lot of communities.
On the transportation issue, I think in my area anyway, we focus so much on Medicaid transportation. And those people who don't have Medicaid, they're kind of like right on the, these transportation companies are, lack of a better term, are just trying to get that government money for Medicaid rides, that they're ridiculous trying to contract with them to help, programs like ours. And, I'm very fortunate that I have a interagency transportation, but when older adults are seeing people that are being picked up in individual cars, taken to one spot, they ride alone, they feel safer in a COVID environment, plus they don't have to wait for people, and yet we can't contract with anybody because those same companies want $600 to take someone from southern Colorado into Pueblo to a visit. I mean, it's ridiculous. So I think that that's a lot of that unfairness in transportation, is that it's so focused on Medicaid, which people feel like then they have to go on Medicaid to get these services when, they don't want to, and, we just keep driving people that way. Same thing with home care. We focus so much on Medicaid that we lose the people that can't afford it themselves, but they're not Medicaid, so, thank you.
Yes.
So transportation is a huge issue in the DRCOG region. They fund 13 different providers and can't keep up with the demand, so another challenge. There's also another comment that was more of a question about the census numbers.
Yeah.
It was asking, the numbers in her region have been challenged and may not reflect the true population. How heavily did the research rely on census numbers?
Where the census comes in is that there's a slide that has the needs. They'll see that column that we used from the census. So and we just do the calculations for you, but if they challenge them and they get it changed, they can just not use our numbers. You apply the percentage to that number. It's a simple calculation. We just try to do the work for you, but they can easily change that themselves. Okay. But now with the weighting, we also use the census, but hopefully that doesn't change as much, like the marginals, like male versus females. If that changed dramatically, I don't think it still would affect the results hugely, but those numbers, actual counts, if that's what they're challenging, that especially if they're challenging trying to get more people in their column, that number, the actual number of people affected, would increase, and I would encourage them to do that if they win the challenge. Okay, building skills for paid or unpaid work. Like I said, I know nationally and statewide it's a huge issue for people of all ages. Do you feel like that? Do you feel like you're doing a good job in your communities with that? Do you feel like older adults really have those kind of resources to transition? Makes sense, doesn't make sense? Don't know.
I think, especially in Boulder County, I feel like we have a lot of this. As I'm looking through each of the bullets that you have here, they all really center around communication and information. Well, many of them center around communication and information. We have resources for property taxes. We have resources for maintaining home and yard. We have some great transportation resources that work through our workforce folks in Boulder County and that everybody has. We've got that. We've got our Medicare team. So to me, pretty much all of this is communication and information. So, and that to me is not surprising.
But is that true for all of you? I just did Montana's, and Montana was saying they don't have no one to give these services. So they offer it at the AAA level, but they have no staff members who will actually do it.
Well,
so I don't know, but are all of you the same? Are all you areas you're able to provide all these? People just don't know about them? That's what I say, because I'm like, I know Boulder is highly resourced. That's the only thing I'm saying. I live there. I love Boulder, but I'm saying they're a pretty highly resourced area. But I just know in Montana, we have money and we actually have services, but no one will work for the amount of money we can pay hourly to do it because there's such a staff shortage. I don't know if other people experience that, but they can't get the people to do the services. True. I mean, yeah. I know. It looks like Aaron wants to talk.
I'm just muttering under my breath at this point. This isn't specific to this slide, but it is something that I found surprising, and I know that we had all had this conversation, and I wonder if it has to do with being a victim of fraud or scam, or if it's just an increased general distrust in government. I'm sure it had to do with the fact that we had a much higher sample size this time. But from 4 years ago, something that really surprised me was the amount of people who either called and they were like, what is this in the mail? I either am not going to do it, I'm not going to give my information to the government, or, hey, I'll take this, but I just want to talk to you to confirm that this is legit because they are concerned about, or they have been a victim of a fraud or a scam. So I wonder, have you seen that? It looks like the response rate was similar, and is that taking into consideration that we paid for a lot more people to receive the survey?
Yeah, it is a response rate based on proportion, so
Okay.
that's all fine. But I do want to speak to the whole safety in general, because we do a lot of safety surveys. This isn't just older adults, but it's safety, public mistrust, polarization, all those issues are affecting all government right now. And I've been doing workshops with a lot of local governments where they actually are feared about the safety of their staff because people are so angry and mistrusting that they're people, even you're the clerk at City Hall, and people are coming in being so aggressive. And I do think it's a national problem with polarization, misinformation, public distrust that's affecting us all in a way. And I don't know what the solution is, but I do think we have definitely noticed that and we're calling it, it's COVID, it's George Floyd, it's the Republican Democrat fighting. It's all those things. As much as we don't want them to impact our jobs, we just did a study where we asked a ton of local government staff, how much does it affect your job? And they're like, it's affecting us. Even though we want to stay out of it, and as government employees, we're not the electeds. We actually don't want to be political. We actually just want to do our job and help people. But the way people feel about government, the way they feel about all these kind of things are impacting our inability to really do our jobs the way we used to. And so I'm not surprised that some folks were more pushback, more concerned, and are reporting higher, because we're just seeing that in our safety surveys and just our polarization. We're seeing government trust, for local government, state government, and all just drop, and it's been pretty consistent for years, and the last year seen big drops. In fact, we saw it with local government. We saw some nice peaks right during COVID, local government's helping us and doing a good job. And then all of a sudden now it's all plummeting, because I think what they're talking about government in general is pervasive, and it's a crisis for all of us, I think, doing public service right now, what's happening at the national level, how it affects us all.
I wonder how that then affects the not knowing what services are available and having adequate information, because I think that's across the board. So here we are thinking that we're doing a good job presenting the information, and all of us, I think all of the AAAs except for 2 are part of some kind of government entity, whether it's a COG or county, and so we're putting out information that's not being received well because we are part of the mistrust. I don't know how to fix that.
It's a big struggle for everyone in local government right now to think about how we can reconnect with, build that trust back up again. And especially if it's things that we're not really involved in, but just the fact that, I'm saying, no, almost every workshop I've given in the last 3 or 4 months, people have talked about employee safety. Not just the cops. It used to be oh yeah, we're afraid the cops might get hurt, but now they're people are just becoming so uncivil. And it's sad. It's really sad.
We have to have law enforcement at our food distributions. We have to bring law enforcement in at food distributions just to keep the peace.
Anything else that was surprising you want to talk about? I don't know we can also go just to the low end. Aaron, if you want to flip back to the just lowest scoring areas, that's another way to look at it, regardless of the benchmarks or time trends. So go back a little farther, keep going a little bit. Keep going. I just want to look at the community characteristics one. Yeah, right here. Higher or lower? Lower. Keep going. Keep going. Oh. Sorry, going backwards. You want me to do it? Yeah, because it does go to the bottom. Next slide, sorry. Okay, sorry, one before, okay. Let me put it here. No, I'm sorry, when I say before and after, that's not helping you, is it? Sorry, so if you do that. That one, okay. So those are where, like, communities are getting low ratings. Do any of those stand out as something that doesn't make sense to you? And we talked a little bit about employment opportunities, but is there anything else there? No.
I do know there's a lot of work happening at the state level, and I don't know who it was in the chat had mentioned that about ageism with a variety of employment opportunities available. I know that there's a lot of work and workshops and information going out at a high level to employers directly and to communities who might be hiring older adults about, hey, don't forget about this valuable resource. Older adults continue to be able to provide wonderful work opportunities. I know that DOLA did a big presentation last year on, hey, this is a valuable resource. This population is great. Utilize them to help solve some of your labor needs. And so I feel like that's happening maybe from organizations getting the word out to the employers, but it doesn't sound like potential older adult employees realize that's happening, or maybe they're still not seeing those opportunities present themselves. So again, I know I've kind of harped on that one, but that one continues to surprise me, this variety of employment opportunities. Yes, ageism, I think we could probably apply some layer of ageism to all of these, but it seems like there's a lot of work being done around this.
And there might be a time lag too, like it takes first, you're starting with the government, talking to employers who then have to change their policies and then get the information out to, so maybe a year from now that will be realized. I also wonder whose DOLA's audience is all the time. So they might be able to talk to some of the bigger employers, but are those small mom and pop shops all around these communities, are they hearing that? Because not everybody's reading DOLA's newsletter. These people are struggling enough with staff shortages. Are they attending webinars and information? I feel like there's probably a lot of employers who have not gotten the word, or also may need help in terms of that transition. They may know I need to employ older adults, but what does that mean? I have to advertise using different modes. I may need to do some more onboarding tech training. They may need just some help or counseling, mentoring, how to help them get older adults ready to transition, when it might be easier, just to hire a 16-year-old because, they're using the iPad to ring up, the customers or something. But I feel like even though that's happening, it's not surprising to me that it hasn't been realized in the, and it's not, and I'm guessing too, we need to do more. That would, yeah.
Yeah, there's a comment saying employment is a huge issue. For older adults, there is little funding for reskilling for low or no cost. So just to your point.
Okay, let's move on then. So, sorry, you're going to flip all the way back. Sorry, I was just looking at some things, just want to get your take on them. Go all the way to, okay, wait, so next slide. So basically this is, and go back one more. So that's going to be the conversation we come back with. I'm going to end soon because we're going to do more work on this. We're going to identify the focus areas, talk more about strategies, do that crowdsourcing, if you guys remember from last time, about things we could do. But wanted to end my discussion here so we can talk about the demographics, because I don't want us to talk about the focus areas. And I don't know how we're doing on time. I haven't been watching, but are we okay?
It's 10:40.
Okay, so yeah, and so, but just knowing that once you hear what the demographer has to say, we're going to get back together and kind of think about those issues, the things we talked about, and maybe try to pick some areas we think as a state we really think we want to move on, and areas where we want to advocate more so based on the data. And then again, we'll move into strategies and just some ideas. Yeah.
Just one thought. In the 4 years from now, I'd really like to see us ask some questions more about impact of natural disasters for folks too. I mean, I guess we're feeling that in Boulder County, but we're not the only ones feeling that for older adults who maybe lost homes and are thinking, well, do I rebuild here or do I go to another community and lose the community I have? So just a thought on that. I'm sure we'll see more natural disasters coming.
We actually have questions on that already. We ask regular residents. So if you guys want to try to incorporate it again,
Yeah.
real estate on the survey is so we always have to trade it off. But when we have these discussions again, if you think that's more important, some of the questions we're currently asking, we could
Yeah.
definitely ask more about it. The other thing though, and we'll talk about this too, the Polko platform does allow you to, like, if you get people, like the open participation, I know we didn't do a ton, we'll work with that, but if you decided to go out, you could actually get a whole bunch of residents from Boulder, and I can give you some of those questions on effects of natural disaster, and you can send it out.
Yeah,
you know.
and I think that will help us in our advocacy too, just in terms of bringing that older adult perspective to natural disaster response and getting, yeah.
So for any of you that don't want to wait 4 years, we have a library on the thing, and I can help you find survey questions if there's other issues you want to dig into. Like again, you'll do like how you're going to publish information through your newsletters or however you want to do it. Send information out to residents. Say please get on the survey, and you can write on natural disaster, food security, whatever, employment opportunities. If you want, we have a bunch of questions already developed on employment opportunities. If you want to get online and ask, send that out. But again, you have to do that marketing and outreach to get people to come to the platform. But if you can get those folks, at least you'll hear from those folks that kind of want to give you more information about you can ask them about, like, can you find training? Is it affordable training? What are your biggest issues? Where do you look for work? I have all those kind of questions I've already developed for workforce alignment, and we have that on the platform if you want to do that. Or like I said, and feel free to talk with us throughout the day and ask us the kind of questions, or we're also receptive to writing you new questions, but you don't have to wait 4 years if you don't want to ask some of these questions.
I just wanted to add to that too that we are currently working with the town of Superior. They are also a client of ours to develop questions specific to the issues that they are experiencing as they recover from what happened there. So we'll be able to use those in 4 years or sooner, as Michelle just said. So we won't be inventing the wheel on questions specifically related to that.
Okay. Anything else before we turn it over to the demographer? Oh, I'm sorry. You turn it over to the break. Okay. Thank you all.
Thanks for everybody who's online. We're just going to take a 20-minute break. We'll be back at 11 with the State Demography Office to continue the conversation with more data.